Well, it's your turn now to ask some questions of the researchers. So if you've got a question, put up your hand and wait till you get the microphone. What about some hands? I'm sure you're used to putting up your hands. Don't they still do that at school? Yeah, what about here in the front row?
This is directed to all the researchers today. How do you come up with a problem to research, and how do you go about getting the research off the ground?
Who's got an immediate response to that? Right.
For me, it's easier. I started as a clinician and a doctor, so one of the first things I did when I came back from the States after all of the training was finished was look at what children were dying of and in cancer types. And so we focused all our energies on those. One of our main tracks is trying to identify the risk of relapse. So all children mostly respond very quickly to treatment. The chemotherapy, you can't see the cancer there. We know it's there, and there's a certain subset of patients who are going on to relapse. And so we invented a blood test that you can actually detect leukemia at very, very low levels. And so it was sort of focusing on the problem. And then technology comes along, and I'm sure a new technology comes along, and that completely changes the way you can address a problem. So.
Would you like to?
Just really quickly, since we work on human disease and with Glenn as well, which is a very pleasant experience, let me say, that we just ask ourselves the question that I encourage the people in my laboratory to say, if we had kids ourselves who had the diseases that we were working on, can we put our hands on our hearts and say that we're doing our best, that we're doing the right things, that we're asking the right questions? And it might not be for a cure tomorrow, but if this disease were in our family and we're effectively working for a cure for ourselves, what are the questions we need to ask and what are the things we need to do? How we kick it off the ground often is with students, especially if something is, something new. System has more good research than it can fund, and so we often have to be in a position to make quite a strong case to get some funding. And so to that we often need to do some experiments before we apply. So we often use students.
Perhaps another question now. Yeah. Yes. Who's got the mic?
To anybody, pretty much. How is high school science like the science that you do today? And did what you study in high school help you to get where you are today?
Yes.
All right. Who's got a story? Would you like to?
Well, I've got a story because biology was my favourite subject in high school. I originally was going to be a geologist, and I'm not sure why, but I had a huge rock collection and fossil collection, and then I was going to be a geologist and discover lots of interesting minerals. But in high school, I had a fantastic biology teacher in year 11 and 12, and the most wonderful thing he did for us was to allow us to dissect a rat. And that was, to me, that was my light bulb moment and my conversion. That initiated my conversion to biology and ultimately physiology, because as well as being interested in geology, I was very interested in how things worked. And I think a lot of people are like that when they're young. And this was the first time that I could see actually how an animal worked. You could see, where everything was, and the teacher was very good about showing us how everything fitted together and functioned together. So that was my light bulb moment. And so I owe my present position entirely to that biology teacher and probably that rat.
Yes, there was one in the front row here.
This is directed to the Minister. Can you explain the role the government plays in health and medical research?
Well, the government provides a lot of financial support for health and medical research, but not all of the financial support. So we provide about $750 million a year through the National Health and Medical Research Council, so about $750 million a year, is quite a lot. But that's only about 12% of the total support for health and medical research. About 19% of support comes from tax concessions, and they go particularly to companies that are at those later stages of development. There's also university funding, of course, when you're teaching and you've got students that the research that gets done there gets funded through the higher education budget. And of course, the other thing is there's a lot of philanthropic donations to health and medical research. You don't need to look too far to see fundraising for kids with cancer, for cancer more generally. In not too long, a few weeks' time, we're going to open a beautiful new cancer research centre next to St Vincent's Hospital called the Kinghorn Cancer Centre. That's got more than $20 million of philanthropic donations to help build that. So it's a big government investment of around $70 million, but it's very substantial donations from, I was going to say ordinary people, but actually that's a very big donation from a very wealthy family. But all of you can help to fundraise for health and medical research. There are great opportunities throughout the year to fundraise for the things that you're particularly interested in as well.
Well, thank you, Minister Tanya Plibersek, and thanks to all the researchers and to Professor Warwick Anderson, CEO of the NHMRC, for convening this event today. And I hope that there are all kinds of ideas flashing around in your heads this morning about how you might one day be up here talking about your life in science, and you can hear the passion, the excitement, the rewards that people here are getting from their work, and it'd be great to be part of that, wouldn't it? And thank you very much for listening today.